Pregnancy. It is the period from fertilization to birth. It starts when a male sperm fertilizes a female egg's ovum in the woman's fallopian tube, making a zygote with 46 chromosomes. The zygote starts to divide, and after 5 to 7 days of dividing and growing, it attaches itself to the wall of the uterus. The moment it is implanted in the wall of the uterus, it becomes an embryo and the placenta starts to develop. After 8 weeks, the developing embryo called fetus. The placenta gives the embryo the oxygen and nutrition and removes the waste through the umbilical cord. How the pregnancy happens: day 1, day 2, day 3, day 4, day 5, day 6, day 7, day 8, and day 9. The normal pregnancy lasts about 280 days, split 9 months, yeah, 14 weeks, the 3 trimesters. Normal delivery could be from 38 to 42 weeks. Fetus in utero, placenta, isoare, umbilical cord, fetus, uterus, amniotic sac, cervix, bladder, vagina, anus. Presumptive sign. Physiological changes noticed by the woman herself. Absence of menstruation, nausea and vomiting, morning sickness, common from week 2 to 12, breast tenderness and swelling, urination frequency, fatigue and sleepiness. Probable sign. Probable sign. Physiological and anatomical changes that can be perceived by the healthcare provider. Chadwick sign. Darkness of the vulva. Godwell sign. Softening of the cervix and vagina with increased in discharge. Hager sign. Softening of the lower uterine segment. Growth of uterus and abdomen. Skin hyperpigmentation. Brownish pigmentation in the face. Darkness of nipples. Linea nigra. Pigmentation of the midline of abdominal skin. Positive pregnancy test results. Detection of human chorionic gonadotropin. It means HCG. In maternal urine or blood, the tests are accurate but not 100%. Positive signs. Objective signs of pregnancy noted by the examiner by positive examination of the embryo. Sonographic visualization of the embryo, cardiac movement noted at 4 to 8 weeks. Fetal heartbeat by using a Doppler in the 10 to 12 weeks. Fetal movement felt by the examiner after about 20 weeks. Physiologic maternal changes. Pregnancy causes physiological changes in all maternal organ systems. Most return to normal after delivery. Increased blood supply to breasts and uterus. Increased level of estrogen and progesterone. Changes in senses of taste and smell and increase in saliva. Softening of joints and increased mobility of the sacroiliac and symphysis pubis. Increase in blood flow. Increased need for glucose, H2O, iron, and folic acid due to developing fetus. Heart rate increase from the normal 70 to as high as 19 beats per minute. Decrease in blood pressure in first and second trimester and became normal at the third trimester. Increased breathing rate, increased in kidney and bladder size. High pigmentation of the skin. Physiological changes. Changes in senses of taste and smell. Increase in saliva. Enlarge of breast. Increase of blood supply to breast. Increased breathing rate. Increase in kidneys and gallbladder size. increased blood flow, increase in heart rate to 19 beats per minute, decrease in blood pressure, increased need for glucose and H2O, increased blood supply to uterus, increased levels of estrogen and progesterone, softening of joints. Stages of pregnancy. The weeks are grouped into three trimesters. First trimester, week 1 to 12. During the first trimester, hormonal changes affect almost every organ system in the body. The baby develops rapidly. The major organs develop in this trimester. The menstruation stopped. Pregnant symptoms and signs, mood swings, headache, morning sickness. First trimester in the body. The baby's brain, heart, and spinal cord have begun to form. Baby's heart starts to beat in the eighth week. Sex organ begins to form. The face starts to form. At the end of 8 weeks, the baby is a fetus and looks more like a human and about 2.5 centimeters. At 12 weeks, we can see if he is a boy or girl, and the baby can make a fuss. Second trimester, week 13 week to 28. Most of the early pregnancy symptoms will gradually disappear. Other symptoms appear such as backache, legs swollen, and heartburn. Stretch marks on the abdomen and breasts. The uterus will grow rapidly in size. Fetus move at about 18 to 22 weeks. Increase of heart rate and blood flow to accommodate the needs of the fetus. Second trimester in the body. Muscle tissue and bone continue to form. Skin begins to form in the 16th week. The baby can hear and swallow at the 20th week. Real hair begins to grow on your baby's head at 24th week. The lungs are formed but do not work. At the end of the trimester, the baby now about 13 centimeters. Third trimester. During this final trimester, your fetus grows larger and the body organs mature. The fetus moves frequently, especially between the 27th and 32 weeks. A fetus usually set into a head-down position in the uterus. Shortness of the mother breath. Belly button of the mother may stick out. The breasts begin to produce colostrum. Third trimester in the baby. The baby's bones are fully formed at 34th week. The eyes can open and close and sense changes in light. By the end of 37 weeks, the baby is considered full term and the organs are ready to function on their own. Near the due date, the baby may turn into a head down position for birth. Due date of delivery. Expected date of delivery (EDD) can be calculated easily by negligence rules by adding 1 year, subtracting 3 months, adding 7 days to the first day of a woman's last menstruation period. Example, LMP 8 May 2009 plus first year 8 May 2010 minus 3 months 8 February 2010 plus 7 days is equal to 15 February 2010. Another method is by adding 9 months and 7 days to the first day of the last menstrual period, LMP.